Hi, I'm Dr. Ernie Bowling. I'm in practice in Rome, Georgia, but right now, like most everybody, we're down, waiting for the corona pandemic to plateau, peak, pass, and who knows what's going to happen after that. But I recently wrote an article for Optometry Times Journal that I titled Hope in the Age of the Coronavirus, because there's so much information out there on the mainstream media, and it's all bad. Every day they put numbers up on the page like a ticker for the stock market, talking about the deaths and the infections and whatnot, and all the information. The news is all coronavirus all the time, and like I said, most of the time it's all bad. I try to be a positive person by nature, so what I wanted to do with this article was talk about there's some good news out there. Sometimes you got to look for it, but there is some good news out there. It kind of gives us hope as far as what's to come, and that's what I wanted to talk about in this article and what I'm going to talk about in this video. First, it could be much, much, much worse. It is. I know sometimes that might not be the best way to look at things, but it could be much, much, much worse. The vast majority of people who are infected with the COVID-19 virus recover. Estimates now suggest that about 99% of the people infected with the virus will recover. Some people will know they've been infected and have no symptoms at all, while thousands have died. Unfortunately, the overall death rate is about 1%, or perhaps even lower, once all the cases are tested and confirmed. And that's far less than the Middle East Respiratory Syndrome, or MERS as it's called, which was about 34% mortality rate, or the Severe Acute Respiratory Syndrome, or SARS, had about 11% mortality rate. Or if you really want to get something bad, Ebola, which had about a 90% mortality rate. Now, granted, the seasonal flu is about 0.1%, so this is much, much, much worse, but still not as bad as some of these others that we've seen. Children, another good thing, seem to be less affected and have a milder form of the disease. While the CDC recognizes the vast majority of patients that have been affected are adults, and the vast majority of the deaths appear to be people who have contracted the disease with underlying conditions, heart disease especially, or respiratory conditions. But when kids are affected, they seem to have a milder form of the disease. For children and parents, this is good news. The other good point, I think, to think about, gives us some hope, is that the testing is ramping up. The U.S. is working overtime to test people. As of April 10th, over 2.3 million cases, patients have been tested. Tests have been reported between the CDC and the private labs. And of that number, 1,912,000 of the tests were negative. The vast majority of the cases are negative. More companies have been granted emergency permission to do testing. Quidel, one of them, has gotten a rapid test. Quest Diagnostics has expanded. There's also CO2 assay from Quidel has received expanded authority. I think it's important that testing numbers are out there and come out, because without testing, we cannot possibly know how the pandemic is progressing. We cannot respond appropriately to the threat, short of a vaccine, which we'll talk about in a minute. We got to have testing. Now, treatment. There are treatments ongoing. The studies are ongoing. The World Health Organization formed what's called a Solidarity 2 study, where they're going to test antivirals, hydroxychloroquine, a mixture of HIV drugs. Other trials are also underway. At least 12 potential COVID treatments are being tested. So that's another good thing. So the disease hopefully is not as severe, and in the vast majority of people, testing is underway. Uh, there are treatments being tested. Uh, the biggest thing a lot of people hear about is hydroxychloroquine, which is getting a lot of news because the president seemed to think it was good. Anecdotal evidence is that it works very well. There is a controlled trial underway. A recent listing identified more than 70 candidate molecules, including 15 antivirals, that could be tested against the virus. The National Institutes of Health lists more than 100 clinical investigations focused on COVID-19 from around the world. In time, we'll likely see the direct-acting antivirals tailored to the most vulnerable molecular targets in this for this disease. There's also being used plasma collected and being harvested for antibodies to the COVID-19 virus. And that was done in the H1N1 influenza panic, the 2003 SARS, and the 2012 MERS epidemic. So the very well known method or means of treating the disease. Of course, the real what everybody to really eradicate the disease and provide treatment for the disease, it's going to take a vaccine. The genetic sequence has been published since January, and so everybody's prospects are now turning to a virus or a vaccine because a vaccine can prevent the infection. The COVID virus is, everybody's seen the picture now of the sphere with little projections on it, and a lot of the viruses or vaccines are being targeted too because they understand that those projections is where the virus attaches and infects the cell. So for some way we can block that, then the virus can't replicate. As of April 8th, there's 115 vaccine candidates, 78 are confirmed active, and 73 of those 78 are in preclinical stages. A couple of them have moved into clinical trials, clinical development. Moderna has shipped its first batch of COVID-19 vaccine just 42 days after the genetic sequence was published. Imperial College of London is designing a similar vaccine using coronavirus RNA, and Anovo is generating strands of viral DNA. It helps stimulate an immune response. Those are all great and wonderful. But what about those of us who are sitting at home twiddling our thumbs? Really don't have anything to do? Well, financial help's on the way. The government has always publicized, the government has passed a huge stimulus package. A lot of the payroll protection plan has already been going out to a lot of doctors who have employees. The stimulus checks are supposed to be arriving sometime this week. There's also the SBA loans that are being processed, taking a little bit longer. But help's on the way, and any and all help is to be appreciated, of course. I think the biggest, longest lasting effect from all this will probably be the advent of telemedicine and throughout the healthcare, and especially in optometry. It's emerging as an effective and sustainable solution, and many chronic patients have scheduled teleconsultations from their home. So that is a very plausible outcome. It gives us a lot of hope to help, again, with the social distancing. And social distancing measures, I know we complain about them, and we're all sitting at home, again, about to go stir crazy, but they do work. They worked in 1918 Spanish influenza. But we have something they didn't have in 1918. That's the internet. And so we can talk like this with FaceTime, with Zoom. So there are other things that we can do to see family and friends. I have a new grandson, and fortunately we've been isolating, so we get to see him now. But for a long period of time before that, it was just video FaceTime chats. And so that's been a big help. So the coronavirus is a pandemic, is a worldwide problem. It's only going to get bigger in the days and the weeks to come, but at some point they will plateau. I was reading Thomas Paine's American Crisis, and the quote that stuck with me at that time is the one I put in the article. These are the times that try men's soul. While while Thomas Paine was describing the American Revolution and the battle against a seen enemy across the battlefield, we don't have that this time. We're at this moment in conflict with an unseen, mindless, unforgiving foe that affects people. It doesn't care who you are, where you are, your economic status, doesn't matter. Yet we're resilient people. The greatest minds are feverishly at work on a problem, and governments around the world are going to devote whatever resources necessary to combat the virus. And nothing that can't be overcome, nothing the American people can't overcome. We're a very resilient people. I believe that this too shall pass, and it's important to have hope in this time that this too shall pass. I'm Dr. Ernie Bowling, and thanks for taking time to watch the video.